Here we have a lower back release. We're going to place the body in this orientation. A good place to start is just on top of the hip joint. We're going to lean over onto the roller towards the quadratus lumborum muscle and then into the gluteal muscle. If you angle it down a little bit so that the body is almost horizontal to the floor, you'll get a little bit more contact of your body onto the roller. You do need a little bit of the arms and elbows. Just bend the elbow a little bit more there, George. Maybe go down on the elbow slightly. It might be helpful. That's it. And then roll there. So now he's going to be using his feet and his knees to pull his body forward and backwards. This has got a little bit more pressure. Angle it so that it feels comfortable for you. Again, if you don't want to stay on your spine, so make sure that you're on your side a little bit. And a nice place to sit and rest is probably also on the gluteal, as it's there's a bit more integrity in the pelvis and back, so it's not as sensitive. Yeah, again, if this doesn't feel so good, maybe don't ease off on the pressure a little bit, and you certainly don't want to bruise this area, particularly around the kidneys area. Here we're looking at a back stretch, one side, by placing the roller underneath the hip. So we're going to, in this case, be stretching out the left-hand side of our back. I'm going to place the roller on the hip bone, slowly lie down onto the mat. The underneath knee is bent. We're going to gradually and slowly lengthen out the top leg. Now we want to make sure that the therapy roller is in a good place on our hip joint, and that the spine is as elongated as we can make it. And then from there we're just going to stretch the top leg away and feel the traction, feel the space between the rib and the hip moving in opposite directions. Take a few breaths in and out. And every time you exhale, just release in through the back muscles, gap open the joints on the left-hand side of the body, and then just release it again. If you find that the stretch is quite strong or the roller is a little high, we can always prop towels underneath the rib cage in order to decrease the acuteness of the roller under the hip. Come up slowly using your hands and then transfer to the other side. Accessing the outer hip, particularly this area here called the tensor fasciae lata muscle, is always a little bit hard to access. I'm just going to show you or bring your attention to how we can access that using the massage therapy roller. We're going to lie down onto the top of the hip joint, and we're looking for softer areas of the outer hip, not too much on the bone itself. You can find that by just rolling upward and down, or towards the foot and then towards the shoulder. Ensure that the shoulder is holding the placement well, that the trunk also is holding the integrity of the upper body. And just moving up and down, you'll discover that you may have tension in the hip area. To increase that sensation, we'll go forward a little bit, and you'll feel the anterior front part of the muscles on the hip and back to the side again. Repeat that. Move the roller maybe just a centimetre up or down, and you'll notice that it will change in the sensation of the muscle contact or the tension areas around that whole outer hip area. By releasing into the TFL, you might release some of the tension on the outer thigh, maybe even some knee pain, and also might address a little bit of the alignment of the thigh bone relationship to the hip joint. To increase the amount of pressure that goes onto the outer thigh, we've opted to have both legs together, so the whole body weight is on the massage therapy roller. Stabilize well with the shoulders, use the top hand just to balance your positioning. We're starting just below the hip and we're traveling towards the knee, and then just come back down again. If you go a little slower, you're almost going to feel that the muscle fibers get a chance to elongate and lengthen, and then bring it back. You're also going to get along the way just certain areas of pressure, and you'll notice where some of the tighter areas of your outer thigh will be. Watch that we don't go onto the knee too much, and watch that we avoid the hip joint as well. If you want to just play around with going forward a little bit so that you're getting the anterior aspects of the thigh. In contrast to that, if you lean backwards a little bit, you're getting the posterior fibers of that outer thigh. You just go up and down maybe about 2 or 3 times, and you could probably stay on a certain area and just trigger point that for a moment as well. Here we've got a gluteal stretch, which is at the back of the hip. You'll also feel a little bit of the outer hamstring in this stretch as well. So we've opted to put Dom up on her toes because that increases the space or the distance between her thigh and her trunk. From here we're just going to go from one side to the other. So we're just feeling the fibers of the gluteals going from the inner to the outer areas of the hip. And once we've hit a nice tender area on the glute, which is probably around this area is the knee, so we're just going to rotate to the right. You can probably feel it in your hip. We're just going to move the roller up and down and try and find any tender areas on the gluteal muscle. I don't think you're quite on that yet. I'm just going to turn it. How's that? There you go. That's a nice. You will notice it when you're on it, and it's pretty intense. So rock backwards and forwards about 3 or 4 times, and then just come back off that. Make sure you do both sides, and be careful too that we don't bruise that area, so you don't want to overdo this. If you're looking at a way to roll out the quadriceps a little bit more strongly, this is a good position to be in. We're going to place one leg on top of the other so the legs are straight. Abdominals hold the spine in alignment, and the shoulder girdle is aiding the motion of the body. We're going to travel forward, and the roller will travel down towards your knees. Then backwards, the roller will travel up towards your hip joints. You want to feel that the weight of the legs, particularly the top one, and the entire body is acting to press down onto the massage roller and releasing some of the tension through the anterior areas of the thigh. You can roll a little from side to side, squeeze the legs together, make sure the abdominals are pressing down, and you'll get a very effective, strong release in the quadricep. We want to try and stretch out through the hamstring as well as release by putting a bit of pressure down onto the roller. Here's a nice way to do it with a single leg pressing down onto the roller. The other foot is guiding the action backwards and forwards. George's hands are trying to keep his body upright, so the higher he props himself up, the more acute the angle of the hamstring and hip joint is. We're going up and down the entire fibers of the length of the posterior leg. Placing one leg on top of the other and squeezing the legs together will increase the pressure and load down onto the supporting leg, and in this case it's the right side. And you want to go nice and close to the hip, nice and close to the knee, but not right behind the knee joint, and rolling on the outer and the inner areas gets your whole semitendinosus, membranosus, and your biceps femoris, which is your outer and inner hamstring muscles. Looking at the hip flexor stretch, we're going to start on the knees. If your knees are a little bit sensitive, this is probably not a good option for you because we do have to flex in the front leg and we are weight bearing on the posterior leg. So we're starting on the knee joint. From here, we're just going to slowly bring the knee back behind the roller. There's still a certain amount of weight going into the roller. You're anchoring the lower areas of that quadricep. Hand on the knee. If you can balance well, reach up towards the ceiling. Gluteals are on, abdominals on, hip is driving forward, and we're trying to make sure that the roller stays fairly steady. To increase it, we're going to push the leg back just slightly and increase this opening sensation in the hip flexor. Just make sure the lower back isn't compressed. It is pretty intense, and we can do the other side about 2 or 3 times. Here's a way to increase the intensity on the inside thigh stretch and adductor release. So starting in this position, we're rolling forward onto the front and feel the roller going into the inside thigh adductor. From here, we're just going to lengthen the leg away so the weight of the leg's a little heavier, bend the knee back, and then slowly roll the hip back again. Twofold, we're rolling and opening up the anterior aspects of the hip joint, so working on the external rotation of the hip, extending the leg, the weight of the leg presses down on the adductor, and then we bring it back. We can play around with where the pressure is by just slightly shifting the roller. And from here, pressing down, extending the leg, lengthening it out, bringing the leg back in again, and controlling it back. So if you press down onto the roller, you'll increase the effect. One more time, going forward, and lengthen and extend. Stay there, we'll do one more time. Extend, so the gluteals are active, the abdominals are supporting position. Press down and then slowly come back into it. Nice way to open up through the inner aspects of the leg. Here's a good way to open up through the back or gap the hip, the spinal joint, and open up through the lower back muscles. So George is just pressing the knees down into the chest. We're trying to close the space between the lumbar spine and the floor. The massage roller is just acting as a wedge there to give him some elevation. And as he breathes out, he's just lowering the back to the floor. A way to add to this is to lengthen out one leg. And you'll find that if you lengthen out through a long leg, we'll open up to the hip flexor a little. So we're going to drop this knee down a little bit lower there, George. So now we've got an open hip joint and an open lower back. This is great for just improving your posture generally, particularly around that midsection or core area of your body. And it releases the lumbar spine nicely. Both sides is always a bonus. You might find that one leg hangs a little differently than the other. It's a good thing just to lie, breathe in and out about 3 to 5 times, maybe 30 seconds to a minute, and just opening up through the hip joints and the lumbar spine.